Dr. Michael Barnes here, board certified psychiatrist. Today I want to go over akathisia. It's actually a side effect of some of the medications that we use in psychiatry, particularly antipsychotics. I want to take a second to go over that. Let's go. So jumping right in, really antipsychotics have side effects, and the way I think of it in my head is that it's broken down into two sections. It can cause metabolic syndrome or EPS. Okay, metabolic syndrome really being increases in triglycerides, glucose, and similar things. EPS, I want everybody, the students that are watching and the enthusiasts, to think of it as like movement problems. You could think of it. These are like movement problems. I'm going to list them. So EPS, briefly, extrapyramidal symptoms, really just refers to a part of the brain where when you look at it, it looks like a pyramid. So they named it like that. And it's called the corticospinal tract. And that part of the brain usually is involved in voluntary movement. But extrapyramidal means the areas outside the brain can also be involved in movement, but really involuntary movement, tremors or unconscious movements, and similar. And that's what we're going to name here. So that's why it's called EPS, for those that have wondered. So these are all movement problems. Specifically, again, I'm going to highlight akathisia, okay, particularly here, but there's other ones. There's dystonia we'll list. Okay, there's tardive dyskinesia, and there's a few I'm drawing a blank, but the worst one is NMS, neuroleptic malignant syndrome, and really I do plan on I have videos on all these and I can highlight them separately, but I want to focus on akathisia. So akathisia is what we call a motor restlessness. Okay, so I'll just write the word restless here because it kind of relates ants in the pants kind of feeling. So it's not comfortable, it's not sustainable. People who have akathisia and they're standing, they'll tend to fidget. It could look even like things in autism, the way they have stereotypical movements, but it's not. It could also look like hyperactivity in ADHD, but it's not. Again, this is a motor restlessness. You can treat these symptoms. So akathisia can be treated. Generally, if you're asking me, what I do is I will lower the dose or change the medication generally. So when you're talking about treatment, certainly you can decrease the dose. Okay, so you can definitely decrease the dose. But another thing you could do is change the medication. You can change the med. And you can also add a medication to potentially treat it. Now, this is a scenario where you add a medication that gives you akathisia. You get good and bad. You don't want to lose the good. You just want to treat the bad. There are some meds for this. So you could use beta blockers. And in some circumstances, benzodiazepines.